That persistent exhaustion, the kind that lingers even after a full night's sleep, might not be a simple sign of aging at all. It could very well be an unintended consequence of the very medication you take every single day to manage your blood pressure. This isn't just about feeling a little tired, it's about a profound, energy-draining reality for millions. Today, we are going to peel back the layers on this often overlooked connection. By the end of our time together, you will clearly understand precisely how widely prescribed blood pressure medications, specifically certain beta blockers and diuretics, can silently chip away at your vitality. You will be able to pinpoint common culprits, grasp the mechanisms behind this energy drain, and, most importantly, walk away with concrete, actionable steps. These steps will empower you to have an informed discussion with your healthcare provider, exploring potential adjustments or natural alternatives that could help you reclaim your zest for life without compromising your cardiovascular health. Imagine feeling genuinely energized again. Many people find themselves prescribed a beta blocker to help control their high blood pressure. Think of your heart as a powerful pump, constantly working to circulate blood throughout your body. Beta blockers function by essentially slowing down that pump, dialing back the urgency and force with which your heart beats. They do this by blocking specific receptors in your body called beta-adrenergic receptors. When these receptors are activated, they typically increase heart rate and the force of contraction. By blocking them, beta blockers reduce the amount of work your heart has to do, which in turn lowers blood pressure. It's like gently easing off the accelerator in a car that's been speeding too fast. The engine runs more calmly, and the overall stress on the system decreases. However, this same mechanism, this deliberate slowing down, can extend beyond just your heart. It can impact your body's overall metabolic rate and how efficiently your cells produce energy. When your heart rate is consistently lower and your body is in a more relaxed, less responsive state, it's not uncommon for individuals to report a general feeling of lassitude or reduced physical capacity. This isn't a flaw in the medication itself, it's a direct physiological effect of its intended action, a trade-off many aren't fully prepared for. Then there are diuretics, often known as water pills. These medications work by helping your body get rid of excess sodium and water. They achieve this primarily by making your kidneys excrete more of these substances through urine. Picture your body as a carefully balanced ecosystem of fluids and electrolytes. When there's too much fluid, the volume of blood increases, putting more pressure on your arterial walls. Diuretics act like a very efficient drainage system, reducing this fluid volume and thus lowering blood pressure. The effect is immediate and often very effective for blood pressure control. However, this process of increased excretion isn't always selective. Along with excess water and sodium, diuretics can also sweep away crucial electrolytes that your body absolutely depends on for energy production and countless cellular functions. We're talking about minerals like potassium and magnesium, which are vital for nerve and muscle function, and even for the mitochondria, the tiny powerhouses within your cells that generate energy. Losing these essential minerals can have a profound impact on how vibrant you feel day to day. A significant review by Krug, Levine, Tester, Brown, and colleagues, published in the New England Journal of Medicine in 1986, meticulously highlighted how various antihyperethicin pledgers, including beta blockers and diuretics, can impact a patient's overall quality of life, frequently citing fatigue and reduced energy as common patient experiences. This isn't just a subjective feeling, it's a documented physiological consequence that deserves your full attention. The way these medications fundamentally alter your body's systems even for a beneficial outcome like lower blood pressure, can inadvertently chip away at your internal energy reserves, leaving you perpetually feeling run down. Now, here's the often unspoken truth, the vital insight that many individuals taking these medications simply do not realize. What if that pervasive tiredness isn't just a minor inconvenience, but a silent signal of a more profound imbalance within your body, one directly linked to your blood pressure medication? Many people accept their fatigue as a natural part of aging or an inevitable side effect, never connecting it to deeper physiological changes. Consider diuretics, for instance. While they are undeniably effective at reducing fluid volume and lowering blood pressure, their mechanism of action can inadvertently lead to significant nutrient depletions. Your body isn't just flushing out excess water, it's also expelling vital electrolytes like potassium and magnesium, which are absolutely critical for proper muscle function, nerve transmission, and energy metabolism. Have you ever felt muscle weakness or cramps alongside your fatigue? This could be a telltale sign of electrolyte imbalance. Imagine your body's cells as tiny batteries. Potassium and magnesium are the crucial components that allow those batteries to charge and discharge efficiently, powering everything from your heartbeat to your thoughts. When these levels drop, it's like trying to run a high-performance engine on low-grade fuel. The output is diminished, and you feel it as overwhelming fatigue. Before starting a diuretic, you might have felt capable of enjoying a long walk or tackling house projects with ease. After some time on the medication, that same enthusiasm might feel like a distant memory, replaced by a preference for the couch, an insidious shift often misattributed to simply getting older. It's not just diuretics. Certain beta blockers, particularly older generation ones, can also have a significant impact on your energy levels and even contribute to metabolic slowdown. While they protect your heart, some beta blockers can interfere with your body's ability to efficiently convert food into energy, affecting mitochondrial function, the cellular energy factories. Think of it this way: your body needs to burn fuel to create energy. Some beta blockers can subtly make that process less efficient, meaning even with sufficient nutrients, your cells struggle to produce the vitality you once had. The result? A generalized feeling of lethargy, a lack of drive, and a pervasive sense of being perpetually drained. A systematic review by Schaefer and Barden, published in the American Journal of Health System Pharmacy in 2006, thoroughly outlined the common electrolyte abnormalities induced by diuretic therapy, emphasizing how crucial minerals like potassium and magnesium are often depleted, leading to symptoms that can include profound fatigue and muscle weakness. This isn't theoretical, it's a well-documented physiological impact. The revelation here is recognizing that your deep-seated tiredness isn't just you. It's a specific, measurable effect of your medication, and understanding this empowers you to seek solutions. But here's the good news. Recognizing the problem is the first and most powerful step towards solving it. You don't have to simply accept this persistent drain on your energy. There are proactive, informed steps you can take today. First, track your energy levels and symptoms diligently. For at least 2 weeks, keep a simple journal. Note the specific times you feel most fatigued, what activities you find most draining, and any other symptoms like muscle cramps, brain fog, or shortness of breath. Be specific. For instance, felt utterly depleted by 3 in the afternoon, couldn't focus on work, or legs felt heavy after climbing 1 flight of stairs today. This detailed log will be invaluable when you speak with your doctor. It transforms vague complaints into concrete, observable data points, making your experience quantifiable and helping your doctor understand the true impact. Second, Schedule an appointment with your doctor specifically to discuss your energy levels and how they might relate to your current blood pressure medication. Come prepared with your detailed journal. Ask very specific questions. Could my current medication, for example, metoprolol or hydrochlorothiazide, be contributing to my pervasive fatigue? Are there alternative blood pressure medications, such as an ACE inhibitor or an ARB, that might have a different side effect profile regarding energy? Or, if you are on a diuretic, ask, could we test my potassium and magnesium levels? And are there dietary adjustments or even a supplement that might help replenish these vital electrolytes? Don't hesitate to ask about dose adjustments or the possibility of switching to a different class of medication known for fewer energy-related side effects. A reassuring reframe here is to remember that doctors want you to feel well. You are providing them with crucial information to help them optimize your care. Third, explore natural, supportive strategies to combat fatigue, always in consultation with your doctor. If you're on a diuretic, focus on replenishing electrolytes through your diet. Incorporate potassium-rich foods like bananas, spinach, avocados, and sweet potatoes. For magnesium, consider almonds, dark leafy greens, seeds, and whole grains. For general energy support, ensure your diet is rich in whole, unprocessed foods and aim for consistent, high-quality sleep. Gentle, regular exercise, even just a 20-minute walk each day, can also significantly boost energy levels over time, improving circulation and mitochondrial function. Additionally, consider targeted supplements like coenzyme Q10, especially if you also take a statin, as statins are known to deplete CoQ10, which is crucial for cellular energy. However, always discuss any supplement additions with your doctor to ensure they don't interact negatively with your current medications or health conditions. Consider this carefully. These natural approaches aren't about replacing your medication, but about optimizing your body's resilience and vitality while you manage your blood pressure. You are not merely a passive recipient of a prescription, nor are you destined to simply endure perpetual exhaustion. You possess the inherent ability to understand your body, to advocate for your own well-being, and to engage in a collaborative dialogue with your healthcare team. This deep understanding of how specific medications interact with your energy levels truly empowers you to make informed choices. You are an active participant in crafting your optimal health, especially when it comes to managing blood pressure without sacrificing your vital energy and overall quality of life. This knowledge transforms you from someone just taking a pill into an informed manager of your own health journey. Understanding the subtle yet significant impacts of your medications is a crucial step towards true vitality. Continue to explore these profound connections with us, because the path to truly vibrant health is always unfolding, revealing insights that empower and transform. There is so much more to uncover, so many more layers of health to reveal, and the journey we are on together will continue to bring you the most honest, science-backed truths.